So my name is Rupert Handgretinger. I'm the medical director of the Children's University Hospital here in Tübingen, Germany. We are focusing mainly in our scientific and also clinical work on haploidentical stem cell transplantation of children, but also of adults with malignant and also non-malignant diseases. And we were since long time, starting about 1995, involved in the development of the method of haploidentical transplantation using ex vivo T-cell depletion. Originally, we started with the positive selection of CD34 stem cells from peripheral mobilized stem cell grafts from haploidentical donors, and later developed a negative depletion approach using CD3 depletion. And more recently, we developed, together with the colleagues from Miltenyi Company, the TCR alpha beta depletion, which is at the moment widely used in clinical trials and also by other centers. So we started about 2 years ago a phase 1/2 trial in 30 pediatric patients and 30 adult patients using the TCR alpha beta depletion approach for haploidentical transplantation of patients with various malignancies, but also some non-malignant diseases like hemoglobinopathies or other diseases, in order to deplete the T lymphocytes from the graft. We use the TCR alpha beta depletion in combination with CD19 depletion. So we deplete T cells and B cells. The depletion of T cells is done to prevent the otherwise severe or sometimes lethal graft versus host disease in this mismatch setting. And the B cell depletion is done to prevent the post-transplant lymphoproliferative disease risk. So the pediatric part of the trial is so far finished. We have reached accrual of 30 patients. We have follow-up of these patients for at least 100 days. Of course, we have to do longer follow-ups, which is currently done. The adult trial is still ongoing and recruiting patients, but also nearly the end, and we also will await the first results of the adult trial. So the results of the pediatric part of this phase 1/2 trial are quite promising so far for the first 100 days, where we have now the follow-up of those patients. We have, of the 30 patients, 28 patients alive at day 100. We have a very low incidence of graft versus host disease. We have only seen either no graft versus host disease or grade 1 graft versus host disease. There was only grade 2 graft versus host disease in about 3% of the patients, and there was no grade 3 to 4 graft versus host disease. So this is a very promising result in terms of graft versus host disease, and of course we have still to wait for longer follow-up of those patients. So in our approach, and we use these approaches since 1995, we perform ex vivo T-cell depletion for haploidentical transplantation. That means haploidentical transplantation means we use a donor who is half-matched with the patient. And in our pediatric patients, that's normally one of the parents, either father or mother. Sometimes it can be an uncle or auntie. But also siblings if they are of adult age. And in order to prevent the very severe graft versus host disease, which you encounter in this kind of transplants in a mismatched setting, we perform ex vivo T-cell depletion. And we started to use T-cell depletion in the first steps in 1995 using CD34 selection, with the microbeads approach developed by Stefan Miltenyi and his colleagues at Miltenyi Biotech Company. Later we improved this method and switched to negative depletion of T-cell depletion using CD3 depletion. And more recently we developed together with the company the TCR alpha-beta T-cell depletion to further narrow down those T-cell subsets which cause graft-versus-host disease and leave these T-cell subsets in the graft which might be a benefit to the patient in terms of immune reconstitution or antiviral effects.